بسم الله الرحمن الرحيم. السلام عليكم. I am Professor Adam Ahmed Adam. This mycology lecture is about candidiasis. The lecture is divided into two parts, 1 and 2. This is part 1. When you finish part 1, please proceed to part 2. Candidiasis is a mycosis caused by the yeast Candida albicans. Candida albicans is part of the normal microbial flora of human body. It is found in oral mucosa, throat, gut, vagina, and skin. It is acquired early in life during delivery. It is a potential pathogen. For this reason, it is known as opportunistic pathogen. The word flora originally means plant population of geographical and climatical areas. You can say Sudan flora. This means the plants in Sudan. Also, you can say savanna flora. This means the plants in savanna area. But the term is modified to mean the harmless bacteria, mainly, and fungi found in the body, in the covering and lining epithelia, in the skin, upper respiratory tract, digestive system, and vagina. The members of the flora lead a symbiotic life with human body. That is to say, they have mutual benefits. Each one benefits from the other. In certain occasions, some members of the flora take the advantage of that occasion and become pathogens. Such pathogens are known as opportunistic pathogens. Regarding Candida albicans, the body benefits from it because it keeps the bacterial flora within their normal perspectives or limits. Candida albicans can become an opportunistic pathogen when certain predisposing factors prevail. These are the predisposing factors that pave the way or the road for Candida albicans to be a pathogen. They are grouped into two groups. The first one, disturbance of normal flora. The balance of the normal flora can be disturbed by broad spectrum antibiotics or antiseptics used for a long time. The antibiotics and the antiseptics kill the sensitive flora, that is, say, the bacteria, and leave space, an empty space, which can be filled by overgrowth of Candida albicans. The other, low immunity. When the immunity of the person drops, Candida albicans becomes virulent. That is, say, has the ability to cause diseases. The immunity can be lowered by physiological factors like extreme of age in very young children when the immunity is not yet mature, very old when the immunity wanes out. During pregnancy, you see here half of the baby is foreign to the mother. If the immunity of the mother is not reduced, she may reject the baby. So as to keep the baby and its growth until full term, the immunity of the mother has to come down. After delivery, the immunity of the mother returns to normal. B. Pathological causes of low immunity. Number one, immunodeficiency caused by diseases, infections, as in viral infections. The example of viral infection is HIV infection that leads to AIDS. Bacterial infection like Mycobacterium tuberculosis infection leads to tuberculosis. Parasitic Leishmania donovani infection leads to visceral leishmaniasis or chalazar. These diseases, as examples, can reduce the immunity, and still there are other infections that can lower immunity. Hormonal disturbances, like in diabetes mellitus, where there is insulin deficiency or insufficiency, thyroid hormone deficiency or oversecretion, as in myxedema and thyrotoxicosis, and other hormones disturbance, cancer, different types of cancer can lower immunity, and the list is long in pathological causes of immunodeficiency. To local trauma, there may be trauma, injury to the barriers like skin or mucous membranes. In the mucous membranes, commonly the ill-fitting dentures in the oral mucosa is commonly associated with oral candidiasis. Drugs. These drugs are used for treatment of certain diseases. Corticosteroids can be used in treatment of bronchial asthma, autoimmune diseases, and immunosuppressive drugs can be used in organ transplantation like renal transplantations and so on. These drugs lower the immunity of the person. To sum up, the predisposing factors pave the way to Candida albicans to become a pathogen. Candida albicans causes the disease by any or both of overgrowth of Candida albicans. So there are causes that lead to overgrowth of Candida, where Candida outnumbers its census, will become more than the normal limit. Allergy to Candida antigens, that's a hypersensitivity against Candida antigens. The two, one and two, may be combined in a disease condition. I have to mention here that candidiasis is not a contagious disease. The patient cannot infect the healthy person. Why? Because every person has Candida albicans in his or her body in health and disease, because it is part of the normal microbial flora. The infection or the pathogen does not come from elsewhere. Here is a summary of types of candidiasis. Can be superficial, like oral thrush, intertrigo, vulvovaginal, onychomycosis, and chronic mucocutaneous. Systemic candidiasis, as in candidemia, where Candida albicans is found circulating in the bloodstream. I'm going to take these diseases one by one in the coming slides. First, we take the oral thrush. This is candidiasis of the oral mucosa, being lingual or buccal mucosa. The types of oral thrush: number one, acute pseudomembranous. Here you see the white curd. This is easily wiped out, leaving red, that is a erythematous mucosal surface. This disease is common among children at the breastfeeding age who are bottle fed. And also can occur in other people who have the predisposing factors. Acute atrophic. Here you see the palatal region, the tongue, and here the patient usually has burning sensation in the oral mucosa, and the disease is associated with prolonged use of broad spectrum antibiotics, and therefore it is referred to as antibiotic sore mouth. Number three, chronic atrophic. This is associated with denture stomatitis. The ill-fitting denture causes low-grade trauma to the oral mucosa, and the trauma will facilitate the overgrowth of Candida albicans. Median rhomboid glossitis, you see here on your left hand side where the red arrow is pointing, the elliptical or rhomboid lesion in the center of the dorsal tongue, just anterior to circumvallate papillae. The circumvallate papillae were distal to the lesion. In many situations, there will be a concomitant palatal lesion opposing the tongue or the lingual lesion. Such a lesion is known as kissing lesion. If it is found, most probably the patient is having immunosuppression. Angular cheilitis is also known as denture-related stomatitis. You see here there are fissures at the angles of the mouth, and commonly due to ill-fitting denture, and in cases also of malocclusion between the upper and the lower jaws, and also in people with overhanging upper lips. Chronic hyperplastic oral thrush, you see here the persistent white plaques. You see here the plaques on the tongue, the dorsum of the tongue. These plaques do not rub off. If you try to remove them, they will not be removed. They are adherent. And also points of leukoplakia, that is say, white areas. These are common sites for oral carcinoma. And also the condition may present as in the left picture on the left hand side, spongy mucosa that bleeds on touch. Then we come to cutaneous candidiasis. And here we're going to talk about the intertrigo candidiasis of the skin folds, natural skin folds or acquired skin folds. These folds are characterized by friction between the opposing skin surfaces and moisture between them. The inframammary area here you see where the reddish area where the red arrow is pointing, this is the inferior mammary area with red lesion, and this is common among women with pendulous breast. Interdigital area, here you see the lesion. This is an acquired skin fold. The infected, it is due to obesity. Diaper or nabby rash, and you see here the red areas, front and back of the nappy. the warmth and wetness due to urine and feces. Such a situation creates a suitable environment for overgrowth of Candida albicans. By this, the lecture is over. I hope that it is understandable, and I wish you all the best.